Good morning and welcome back to White Mountains Today here on White Mountain TV 16, Tuesday, February 16th. And Kim Prue is joining us today. We're going to talk about Heart Wellness Month. I guess there's a whole bunch of different names for February, but so let's talk, why is February involved with the heart?
Well, February is American Heart Month through the American Heart Association, and we're concerned about it because we're all about hearts at the hospital. I work in heart health and wellness, and we have a cardiac rehab program as well as some other programs that gear to heart health and just health overall.
So it's a good month to be thinking about it, but let's talk about cardiac wellness. I mean, that's one of the things that Memorial is very strong on, and getting people back up and running. We'll even say running. So
right, absolutely. Anytime people undergo anything heart related, if they have a heart attack, if they have a stent, if they have bypass surgery, there's a whole gamut of situations that they can come. They participate in cardiac rehab. They come to us for, anywhere from 6 to 8 weeks. And the outcomes are amazing to see people come from, they're pretty surprised at what they have to come from to go to. And,
right.
It works out really well. Research has proven that people that participate in cardiac rehab have a far better outcome and are less likely to have another event down the road.
And I think it's one of those things that perhaps a lot of people wouldn't think about. You injure your knee. We've all learned, okay, you have to exercise your knee. You got to, but your heart's a muscle. You've got to get it back in shape.
Right. Absolutely.
And so that's where you guys come in. So how does somebody get? Obviously, they might be referred to you, but do other people come in based on recommendations? Maybe they haven't had a heart attack yet, but you're going to try to prevent that? Yep,
we have a whole prevention program. We have weight loss programs. We gear towards people that have high blood pressure, high cholesterol. I mean, really anything. Just heart health in general. We have a maintenance program that is not insurance-based. It's a self-pay program. Works just like a gym membership would. Yep. They can come. They have the access to us. We work with them one-on-one, get them set up on specific programs that are going to help them to the best of what they need. So. And where are you located? Are you in the hospital or you were in the adjacent building now? Nope, we're right in the hospital. We're in the same location. It's right across from the lab. Most people walk into the hospiel and know where the lab is and where they have to get their lab work done. And we are right across the hall from that. And so plenty of room so you can, have plenty of people there. So it's not, and you got, plenty of patients coming in. What I'm trying to say is that it's not one of the things like you can't fit them in. Right. No, we have plenty of space. We have a gamut of equipment. We've got treadmills, ellipticals, steppers. We have seated new steps, which are like a seated stepper. We have free weights. So we have a gamut of equipment. There's plenty of space in there. We gear to the individual. Well, there you go. We've been looking at some photos too as they've been bouncing around on the screen. So a variety of people who have had some, who are there for different workouts and different training, I guess. Yep, you can come in at any time of the day and you might see somebody on a heart monitor, or you might see somebody that has pulmonary issues that might be watched for more, their oxygen saturation levels when they're exercising, or you might have somebody that's not, hooked up to any special equipment and is really there to just be fit and be healthy, and maybe they have a family history of heart disease and they don't want to end up there and they want to, be focused on good heart health. I would say probably the first step, of course, is to consult with your doctor. Yep. And get the information you can, and being a knowledgeable doctor, of course, they might refer you to your program. Yep, we also have call-ins and drop-ins, and we can connect with doctors to get orders signed. Not always necessary if there's no underlying health condition. If there is, we absolutely would go that route. With cardiac rehab, those usually come through with a doctor's referral. Yeah. Well, that's great. So, I mean, it's great that we have it, that we've got it right here in the Mount Washington Valley. It's so accessible and really, easy to get to. That would be accessible. But it's just one of those things that we're very fortunate, because otherwise you might have to travel very far, but to have such a strong program. Yeah, we've got a great program. We have people come from quite a distance to us. We have people coming from Brownfield and Tamworth. So some of the farther locations actually come to us here in North Conway. Well, that's great. So Kim, I'm sorry. That's okay. You were talking about Kelly earlier. What if somebody wants to get involved with you and with the program? What's the best way for them to get in touch with you? They can call 356-0616. Calls directly into our room, into our exercise room to reach us. I would say it would be the best way to reach us.
That sounds great. Well, thanks so much for coming by today and letting us know what's going on. So it is Heart Health Month all around the country, not just here in the Mount Washington Valley. So Kim Prue, thanks so much for coming by.
Thank you.
And we're back here in a minute on White Mountains Today.
Therapy at Memorial Hospital will help you return to your optimum best. We offer sports and orthopedic physical therapy using proven therapeutic treatments, including trigger point dry needling and Graston technique. Our physical therapy experts will work with you to reduce pain, recover from surgery or sports injuries, and many other conditions. Conveniently located